This is the Healthcare Education Transformation Podcast, a podcast brought to you by two physical therapists devoted to helping physical therapists and other healthcare providers become better educators to patients, students, the community, and each other by interviewing prominent and passionate people within the realms of healthcare and education. The Healthcare Education Transformation Podcast is intended literally for educational and entertainment purposes only. No clinical decision-making should be based on only one source, and therefore this podcast should not be used as personal medical advice. While care has been taken to ensure accuracy, occasionally mistakes and factual errors can be present, as we are only human. This is our journey on the road to becoming better educators, so get ready with your pen and paper as class is about to begin. This is the Healthcare Education Transformation Podcast. I'm one of your co-hosts. I'm Brandon Pollen. And of course, as always, I am joined by my awesome co-host, F. Scott Veal. And today we have a very special guest joining us. Now, today's guest is a CEU instructor within the Mulligan concept of manual therapy, who I've had the pleasure of learning from when I took the upper quarter Mulligan course in Indianapolis earlier in this year, and who I've remained in contact with throughout that time. And some things that really stuck out to me about Eric as an instructor was that his message was very easy to understand. He's humorous and engaging, which definitely helps. He's open to discussion and new technique modifications. He's very approachable, and he really truly does advocate for an eclectic approach. So Eric Dinkins is a graduate from the University of Colorado Health Sciences Center and has been practicing since 2001. He has earned postgraduate certifications in manipulative therapy and is a certified Mulligan practitioner with the Mulligan concept of manual therapy. He earned his board certification as an orthopedic clinical specialist through the American Physical Therapy Association. He is a credentialed instructor from the North American Mulligan Concept Teachers Association as well. Eric has an extensive sports medicine background and has worked closely with physicians from the Steadman Hawkins Clinic in Denver, and he has treated athletes from youth to Olympic and professional levels. He is a published author and was a keynote speaker at the International Mulligan Conference in 2009. And his other clinical interests include treatment for restless leg syndrome and utilizing the motion guidance system to improve visual feedback and rehabilitation. He is currently a physical therapist at Select Physical Therapy in Castle Rock, Colorado. And when he's not practicing, he enjoys spending time with his family, mountain biking, and playing guitar. Nice touch. So Eric, thanks a lot for coming on the show and for all your work as a CEU teacher. And I realized that I kept your bio relatively brief in the intro, but was there anything that you'd like our audience to know about you that I didn't mention?
Well, first off, Brandon and Scott, really appreciate the opportunity to come on your podcast and getting to know you guys a little bit recently, and just appreciate the opportunity. But apart from the things you already opened with, I'm also the part owner of Motion Guidance LLC. And I was born actually in New Jersey, and I've been living out in Colorado since I was about 18 months old. My parents moved out there when I was just a wee babe, and they asked me if I wanted to come, and I said, well, shoot, I got nothing else to do, so I'll just come along with. But it's nice because I travel back east to teach every once in a while, and when I'm in New Jersey, I totally claim the rights of being from that area, and when I'm not in New Jersey, I just kind of let it go. So
yeah, I hear you, man. I do the same thing with New York. It'll always be home, but it's nice to be able to pick up and leave sometimes too.
Absolutely. People ask, well, where are you from? And it's like, well, it doesn't matter because everything's off the turnpike. You just kind of drive off the same road and you'll find it eventually.
Exactly. Well, Eric, for our audience of student physical therapists and physical therapists who maybe aren't aware of the Mulligan concept, do you think you could give us your 30-second to 1-minute elevator pitch on what the Mulligan concept is?
Oh, definitely. So in a nutshell, the Mulligan concept is pain-free options in physical therapy. We're drawing from various mechanisms and inputs that actively engages the patient during the treatment sessions, and it's otherwise known as mobilization with movement to a lot of people.
Cool. No, awesome. And Eric, do you think you could tell our listeners a little bit about your journey into how you got into teaching for the Mulligan Concept Teachers Association and kind of how that all started?
So my first influence from mobilization with movement came directly from Brian Mulligan himself. Way back in 2004, he was in Colorado. I was looking to take some continuing ed, further my education those first 2 to 5 years after being out of PT school. And he had an advanced course of the Mulligan concept actually at that time coming in, and I'd never taken a class. So I got a little bold and I stepped out and I emailed him directly and I said, hey, can I sit in? But I've never taken any of these techniques, but I'm super interested. And since you're coming into my hometown, can I sit in with you? So he said yes and gave me the thumbs up. And me and one of my colleagues that I was working with at the time, we both went and, we sat down. It was just kind of mind blowing in a way. I mean, first thing you'll notice from Brian Mulligan is he just has a ton of enthusiasm for rehab and for life in general. But he was kind of breaking all the rules of the stuff that I was learning in PT school, to be honest. I mean, we were going through a bunch of special tests and we were looking at weaknesses as a deficit, not necessarily as things like inhibition. And everything was centered around pain, painful structures and painful in ranges and things that weren't moving well. And Brian introduced things in front of us that it's kind of blown me away. They didn't make any sense, to be honest. And I was working with an orthopedic group that we thought we did things pretty well. We saw 80% knees and shoulders, and we worked heavily with doctors and with athletes, and people got better. And the things that Brian was showing us, they didn't necessarily fit the model that we were treating under, because we were geared all toward the limitations and not the possibility of taking those away during functional activities. So after I got done with that class, I definitely wanted more. So I went on and I took more courses that were offered through the Mulligan concept, and became a certified Mulligan practitioner in 2007, a few years later, which all that really did was show that I had some competence in the area, and it gave me an avenue to be a referral source in Colorado for people who were seeking out those techniques. And I stayed around the concept, and I went to 9 other courses after that, just kind of being around the teachers and seeing how it is taught. And sure enough, every time I'd go, I'd learn something new, or I'd forgotten about that, or man, that opened my eyes to a different way of being able to teach. And eventually there was a need for more instructors as the concept kept growing. And there was more need of instructors kind of moving in and out of different areas. And I became a part of the Mulligan Concept Teachers Association in 2014. And so for the past 3.5 years now, I've been working with the concept and just really enjoy it.
Yeah, Eric, for those of us who have never done any CEU teaching, could you maybe walk us through the entire process of what that entails, maybe from like how you're selected to do a course, the travel and lodging, the class prep, teaching the class, and then like after CEU reflections and things like that? Could you just kind of walk us through that?
Yeah, absolutely. It's definitely a lot more involved than just putting something up on a website or sending out some emails and getting things going. I mean, definitely with social media and website access, you have to have that piece going behind that. When I get selected to do a course, because I teach through our organization privately, I also teach through some contract stuff and some other things. You got to get that personal contact in there. And once you're selected to do a course, there's a contract that goes into that, and making sure that everybody's on the same page, and some money's up front to reserve the date and the slot. And then establishing that the venue is going to work for how many people that they want, and whether they have appropriate audio-visual equipment. And I personally tend to travel with my own projector, and it's a lamp-free thing, so I don't have to worry about that going out anymore. And it's super compact, and travels real easily, and that makes me feel better about getting to classes prepared. But you have to gather all the emails. You got to get all the paperwork together. You got to mail stuff out and make sure it gets there. You have to establish travel dates and times that if something was going to be delayed getting to, let's say, Indianapolis, because that's where I met Brandon. I got to make sure that my flight options are at least there's a few more options after the one that I choose, because if one of those gets hung up and delayed, then I can't get to the course. There's different types of course preps, and then making sure that I can get the certificates ready for those people that actually complete the whole weekend course and show up. And then then you got the unexpected of people who cancel in the last week, and how do you handle those people? And people who didn't show up on day of, and what happens with that? It's I've always wanted to teach since I got out of school, and it's just brilliant for me. I really love it, and I'm blessed to be able to do it. But it definitely comes with some of its hassles and its stresses along with it for sure.
Yeah, Eric, I think that's a really interesting take and really good for our audience to hear. And I'm kind of curious, when you have someone who cancels or doesn't show in that regard, does like Mulligan have a policy that you guys use, or is that more up to the CEU teacher's discretion, or how does that process work then if that were to happen?
So currently, the MCTA and a couple other organizations that we work with, we're willing to take late cancels and not do refunds, but give credit for future courses. And that's going to be within 6 months of the course that they were kind of canceling for. If they are canceling 30 days or more before the start of the course, they're just automatically refunded that money, and we open that slot back up. But there are considerations for courses that are getting close to selling out, or that they do sell out. We want those slots available for the people who can make it, and people cancel for a variety of reasons, and most people are very sincere about it, and they want to continue to make a course in some place, or they want to switch courses to another facility, and we try to accommodate that as much as possible. And usually we don't run into any significant pushback on those things.
Yeah, that's interesting, man. Eric, from your perspective in the organization, what are some things that Mulligan is looking to change to their upcoming courses and such to improve?
That's a great question, because we're always looking to improve our product in the sense of delivery for people. So one of our big directives in the past couple of years is name branding and marketing, and trying to get more words out there for what we're doing. Probably the biggest thing that I hear from people when they come to a Mulligan course is, oh, I saw this one technique in PT school, or I saw this one technique that one of my coworkers was using, and it worked, really well. So I just wanted to come and learn a few more techniques, and techniques are great, and a lot of the techniques in the Mulligan concept work really well, and some of them have been researched and are very good techniques to follow based on the literature. Things like cervicogenic dizziness and distal fibular stuff for the ankle and that sort of thing, but and lateral epicondylasia. However, the concept is not about a group of techniques. It's about following certain guidelines, which include PIL, which is an acronym for pain-free or symptom-free, immediate result, and long-lasting. And then finding a way to make that fit the person that's in front of you. And if it doesn't work, it doesn't work, and you move on. And we have a variety of avenues and things to look for and techniques of how to accomplish that, such as communicating with your patient right out of the gate about what to expect, to doing repetitions, applying overpressures where you can, having knowledge about the area, how to sustain environmental changes through large functional ranges of motion, and then just some expectations for therapy. So we have to get that message out to what we're trying to do, because most people don't have these skills in clinic. They don't know how to go for symptom elimination versus creating pain in what they do. And that's probably our biggest forefront about what we're doing, and also how to talk about mechanisms, how different mechanisms influence different people, all the way from psychological things and contextual effects to neurophysiological effects to biomechanical effects and things like that.
Yeah, social media and branding and even rebranding and getting your information out there. I mean, that's definitely becoming more and more important nowadays, for sure. Eric, what do you think are some of the pros for working for a major international CEU company?
Oh, there's a long list for sure, Scott. So if I can condense it down, there's probably the big ones are going to be collaboration. So working with a major organization, an international one, we get to understand cultural differences around the world very easily. We get to work with different dynamics and different inputs very easily. So that creates a broad vision for what we want to accomplish as an organization. Therefore, you have a lot of support. That'd probably be the next one that I'd put in line. We have people who have, gotten sick, people who have had illness in the family that have not been able to go to courses, and we can find replacements for them. so that people don't have to, go without or have their life be stressed out because a course needed to change. We can accommodate that as a big organization. We can also have delegation. I mean, there's a lot of moving pieces and puppet strings that need to go on with a major organization with continuing education. A lot of responsibilities from the branding and marketing side to getting the current research implemented into what you're trying to do for us as an organization and establishing changes over time. And so you need to be able to delegate certain things away. And so working for a major international continuing education company allows us to do that mostly seamlessly, sometimes not. Sometimes you can't get enough. But that's those are a couple big ones. And I'd probably also put in there just representation. While social media allows us to get our fingers out there very quickly in different ways, such as Twitter and Facebook and Instagram and the like, you still have to have that personal representation wherever you go. Learning styles differ so much between people. You have to accommodate that, and some of that's being in your face in real time. Some people don't learn that well, and they can't transfer the information by just learning it off a video. Some people can do that very, very well. So we have that representation piece that I've really enjoyed for the last 3.5 years.
Yeah, Eric, those are some interesting points on that, and it's good to know. And of course, now I got to go the other way and ask you, what are some of the cons for working for a major international CEU company?
Well, there are always challenges when you're working with enough hogs in the trough that want to be the big boy, right? So you always have egos that you have to kind of work through. And, once you're around different teachers for a while, it seems like family. And I think everybody can relate that that family can get its challenges for sure. But at the end, you're still family. And you tend to try to work through those things. So thinking about, differences of opinion and directions that we want to go, that could be very challenging to get stuff done in a hurry. Some people like to kind of sit to where they are and what they know has worked for a long time, and then some people have different vision for what's getting done. And so probably the con for working with the largest con for working with a major international CEU company is just working through those differences in a timely manner to be able to adapt to the shifts that we have going on. And some of them end up being paradigm shifts that you have to adapt to fairly quickly, and that can be a little bit of a limiting factor from a speed standpoint.
Yeah, just like any company, the more it grows, the more kind of corporate feel it gets to it, and a lot of ladders, steps to kind of get through and work through in order to get things changed in a timely manner, for sure.
Yes.
So, Eric, do you think you could tell our audience a little bit about the salary aspect and the financial incentives that you get for being a CEU teacher in the Mulligan Concept Teachers Association? I mean, is that something that you could turn into a full-time career out of? Is it something that, people mainly do just on the side, or how does that work? What's the setup like?
The MCTA, as far as a setup, all of our clinicians are still our teachers, are still clinicians. So they're still actively treating on a regular basis. They're not just teaching full time. That it can be very lucrative depending on how you set up your business and do a lot of things privately and market yourself, or working through different outside contractor companies. The MCTA currently has a contract with Northeast Seminars, and so we work with them a little bit. So the clinicians are usually still in practice for the MCTA. Now, as far as how that might set up with our organization versus some other organizations, as far as like the McKinsey or things like that, I can't really speak to that because I don't know them. But I do know from networking myself with other people, there are different types of structures that people can use for as an instructor for CEU classes. So, for example, you can use a fee per participant, where it's a flat rate in order to sign up. And teaching privately, we're going to standardize that. Hey, every teacher has an equal say or an equal chance to not undercut another. So we say it's going to be X amount of dollars when we teach per participant. And if you're a host, every certain number of participants, you might get a little kickback as a free participant slot. I've also seen some set honorariums where, hey, we'll do all the footwork and we'll set this up for you to be established at this particular facility. We'll help you get in through this airport and help you with this car to get you to this location. But you're going to make X when you get there, and they take all the rest of the profits. So that's not a bad setup from a standpoint of just being able to stress-free, have your presentation, make sure they have the content, and you show up and teach. And a lot of people like that setup because they don't have a lot of extra time with other things going on in their life to be able to spend a lot of time doing some marketing and branding. You also have some things that other people are doing that they have a set honorarium, and then everything after that is a 50-50 split between the host and the instructor. So you have some people out there who are actually giving the opportunity for the host facility to have revenue from getting that CEU course, getting a popular instructor in there, and get participants in the door. With the MCTA, we already have a set fee per participant is how we work it with ours. So, that's not going to change. That's going to be the same for all the instructors in the Mulligan Concept Teachers Association. When you set up things privately, though, and if you were to do different things, maybe even on different topics, you're at the mercy of how popular you think your course is going to be and how much draw you might get. So that's where some of the honorarium splits of revenue have become a little bit more popular, but that's set up initially, and that's part of the contract. And small money downs is usually the way that goes. And I've even talked to some instructors with different techniques and different organizations that honorarium is set apart from travel fees and all that sort of stuff, and other people that's kind of included in all that. So to each their own on some of those situations.
Yeah, sure. No, fair enough. So Eric, we know that there's a lot of people, from new students, new grads, or even practicing clinicians that want to get more into teaching in some regard. But, for those that are considering teaching CEUs or considering going down that road, what are some questions that someone should ask themselves to see if teaching CEU courses is right for them or not?
Well, you definitely have to be prepared for a change in lifestyle. There's a definite financial draw that people can see up front. But you got to be willing to travel, and you have to be willing to dedicate yourself to what you're going to teach and be in constant review. The time, the preparation, the post-course certifications, maybe even being able to go out and try to get on like the pro cert list, being able to dedicate time to marketing, understand how much printing can be in a one lump sum up front, understanding how to talk with hosts. I mean, all those things for those, some of those communication skills that you have to have. Not everybody has those, and some people think that they have those, and they kind of get into it. And it's like, hey, maybe I don't want to do this as much as I thought I would. Definitely from personal experience, for my first 3.5 years, I mean, it turned into, there were enough opportunities to try to teach in various avenues that I had. I found myself being like, whoa, be a little careful what you ask for, because I have 2 fairly young kids. I have to make sure that they're still my priority, along with keeping my wife happy, and getting home late on a Sunday or sometimes early Monday morning and going to work on Monday morning at 7 is not the most fun lifestyle out there. While it's a nice payday sometimes on a weekend, there are definitely some things that you have to account for being committed to teaching in the CEU arena.
Yeah, that's a great insight on that, Eric. I don't think people realize how much really goes into the time on things unseen aside from just teaching the course. But what would you say are some of the most valuable lessons in regards to teaching that you've learned as a result of your experience?
Definitely some of those valuable lessons are you can't go in with a game plan of how you're going to teach or expect how things are going to go. You definitely are going to have an outline of how you want things to go, but you have to be willing to commit to the people that are in your room, the people that are in front of you that you're trying to impart knowledge on. So part of that is making sure that your knowledge is current and that you are presenting in that in as much of a non-biased way as possible. At times being critical of things that you're teaching as well as things that are already being done out there in the real world. So you have to come in with a with a little bit of an open mind, an open feel, a willingness to deviate from the structure, but also stay on time. And that takes a little bit of a dance sometimes, And so sometimes I find myself not eating much lunch so that people can, practice techniques and ask questions, staying late on the first or second day, just to be able to answer questions and make sure people understand what they're getting out of the class. I really believe in what we teach in the Mulligan Concept Teachers Association. I think it's a phenomenal approach to both assessment and treatment of an individual. And I'm so passionate about it. I need to make sure that people are conveyed that passion. And if they're not getting it, I need to dedicate more time. So the most valuable lesson is definitely, keeping myself accountable to the things that I'm teaching to others.
Yeah, no, I think those are some good points in there, and it's really true. I mean, you can tell. I mean, I've taken a few courses as well, and you can tell who's got the passion and who doesn't pretty quickly within the first few minutes of the opening lecture. I think, like you said before, I think that passion and being able to really adapt. I mean, have an outline, but being able to adapt to your audience and staying current. I mean, I think that's very true, and that holds accurate. And you're right. And I've only taken the upper and the lower quarter Mulligan course. I've not taken advanced yet. I'd like to in the near future, but I really have found that this method really is very helpful adjunct. And you're right. It's not the be all end all. I mean, there's way more that goes into treating a patient than just techniques. That's just one part of it. But there are definitely some definite pros to this concept that are unique compared to others. And some of the techniques are just absolute winners. Like, I think I messaged you after I first learned the lateral epicondylitis one. I was like, oh my God, that made wonders for this one client of mine who I wasn't getting significant fast results with. And what a difference. I was like, holy cow.
Yeah, and that's one of our most, researched techniques. And it's just a strong consideration, just like with everything. I mean, but I think you said it pretty well, Brandon. You're not going to find anything that works for everybody out there. But if you're willing to commit to a certain thought process of what you want to get done, you're going to find some drastically changed outcomes in your clinic.
Yeah, and I love too how it's like you and the patient both know with that comparable sign whether it's making a difference or not, and how you can modify. And that's probably my favorite pro to the Mulligan technique. It's very fast, easy to apply in those directions, to assess. But then right then and there, you don't have to go down and do a technique or something like that, then get them up, do your comparable sign, and then kind of hope that it changed it.
Yeah, no more crossing your fingers if they respond to the technique, in real time what you're trying to do, and it actively engages that patient. They have to be part of the treatment session when we treat them with mobilization with movement. They can't be just passively taking it.
Yeah, no, absolutely, for sure. Eric, kind of switching topics here just a little bit. You're also, as you mentioned before in the intro, you're the founder of Motion Guidance. Do you think you could tell our audience about what Motion Guidance is?
Oh, absolutely. You can also find all this information at motionguidance.com on the internet. But we're a visual feedback company, which gives you immediate feedback by being able to put a laser on any body part to understand what movement is happening, whether it's limiting that movement or promoting more movement. We have a full clinician kit that we've put together that includes multiple targets and 3 different flags and hooks to be able to hang it anywhere in your clinic with suction and sticky hooks and different belts and mounts, a full carrying case. You get 2 lasers, and recharge batteries that go onto that kit. In the sense that we give you extras so they'll last you for a long time, and we fully support our products, so we have a full warranty. But what I started noticing over time, and there was a lack of awareness from my patient because they weren't getting that visual feedback in motions that they were doing. Visual-based learning is 40% of the learning style that's out there. In classically and physical therapy, we're using a lot of kinesthetic awareness and a lot of auditory cues, and we're not getting a lot of visual stuff going along with that. So my business partner, Tal Blair, he when he was doing a residency with me years and years and years ago, he just came up initially with the idea of getting lasers pointers somehow on the body to help us as clinicians understand the movements better that people were getting. And it's just developed into a phenomenal product right now. And we're just super excited about it. We're on par this year to be double what we were last year in 2016. and establishing relationships. And it's just a wonderful device.
Cool, for sure. And you have it for different body parts and stuff, right? Like, neck, knees, and such. Is that correct, Eric?
Correct. Yeah, the different size belts that we have in there, you can put it on a head cradle, you can put it on a wrist and a forearm, you can put it on a knee. The design is a ball and socket mount, so we have two different mounts that with the ball and socket allow you to acquire any angle that you need to assess, and it's a super mobile but also super rigid platform. So that allows it to not move even with acceleration activities or where the person's just doing more static type of things. It's a reliable device, and you can put it anywhere.
Cool, and that certainly seems, logical when you explain that. But I'm kind of curious, Eric. Do you know of any of the big research that what they say about kind of the visual feedback and stuff? I mean, granted, I realize that's probably very specific to the region, condition, and such. I totally realize that. But is there any big research that you know of that really seems to really point in the favor of visual guided systems like this?
Oh, absolutely. Like we have things that are specific, like what you're saying. So as far as joint position sense air in the neck after whiplash, we have strong joint position sense airs there. We have strong joint position sense airs for chronic low back pain. Things that people can't feel and they don't know they're existing, and sometimes even tougher for a clinician to be able to diagnose. We know that happens with certain shoulder conditions. As well, and definitely at the knee, status post ACL injury, proprioceptive deficits. As far as visual learning goes, you have to incorporate it. There's some studies out there that say visual dominance on motor learning can be up to 92% on complex tasks for learning and holding retention. Gabby Wolf has done a lot of things out of University of Las Vegas, Nevada, Las Vegas, or understanding external feedback. So a laser out in front of you gives that automatic external focus on what you're doing and draws things away from the body, and we know that improves motor learning and retention. So there's a lot of things that are incorporated into the device besides just, hey, putting a laser out there. And I've actually done multiple webinars now that you can find on that website at motionguidance.com. And go in there, and I have all the current literature on that stuff, and they're just meant to be information for people, and that's a nice, valuable resource if you need to go seek that out.
Yeah, very cool, Eric. I love the idea of using the lasers for that. That I think it's a cool training tool, and it definitely helps the patient kind of visualize it too.
For sure.
We like to wrap up each episode with this question, and we'd love to get your intake on this, but if you could change one aspect of higher education, DPT or otherwise, what aspect would you change, and how would you change it?
And there's a lot of need for change out there. I would have to say that the first thing that comes to mind would be cost. If we can figure out a way to lessen the debt load coming out of advanced programs in schools, we have to be able to figure that out. I mean, we have PT students coming out in my area. They're about to get married to each other, and they're both looking at six figures, debt that they each acquired, and they're going to bring that together for a family. So, especially in Colorado, I mean, you're starting out with an easy house payment. It's not going to go away very quickly. In some of the regional areas that the salary based things, it doesn't accommodate for that over time. I mean, it's you don't get even in that for 20, 30 years. So, inside of that is that our training doesn't make us super specialized coming out. We still have to get even more information coming out of that. I know some schools have tried to, develop ways to lessen that cost by going with a mixed program of 3 years undergrad and then 3 years grad. If you're going to the same school, you just transition right through. So they kind of give you credit for that, and that lessens it. Or our local program at the University of Colorado Health Sciences Center, they have an internship program now. So they've taken the last 4 months of graduate studies and they've put people in clinic, and it's going to be a paid position in clinic for the last 4 months. And then that lasts for another 8 months of postgraduate work. And that kind of blends the mentor modeling with a little lessening the debt and gives them a little bit of money up front as well, sort of like a residency almost, but in a different sort of a program. But we're constantly trying to improve our value in physical therapy, and we've been able to show that repetitively over time with different conditions like knee pain. And let's stop injecting lateral epicondylation with steroid, huh? I mean, the evidence is pretty overwhelming. We're not relying on imaging at first. Why get an image just to protect yourself? You almost feel like it's more like we're the land of litigation. And that's why we get imaging rather than what's best for the patient, for the cost of the healthcare system. So there's a lot of ties into that. And I know it's not a simple answer, but yeah, that's where I think we should start. We got to figure out other ways to allow people to have this education without having to continue to work for it just to get even for a long period of time after they're done.
Yeah, no, I totally agree with you, Eric. I think that's a very important issue that definitely needs to get looked at more to a degree. But Eric, thanks for so much for coming on the show today, man, to provide your insight on your role of being a, CEU teacher within this company. And, where can people find you online and on social media?
So I personally have a Twitter handle at MCTA_Eric. You can find me there. I also have an @Motion Guidance handle on Facebook and on Instagram and on Twitter. I chose the Twitter account for the Mulligan Concept Teachers Association because it's a really quick thing that you can access on your phone. It's only 140 characters. You can't get sucked in too much unless you want to be. Versus some other platforms, you can read paragraphs of information before you realize this is not for you. So that's kind of the quick hitter, and that's where you can find me.
Cool, Eric. Well, thank you so much for coming on, man. We appreciate it. And, maybe I'll see you at some point in the near future when I take the advanced. I don't know how it looks up because I know I was in the Midwest before now. And now that I'm on the East Coast now, that might change a little bit. But, hey, we'll see what happens and we'll kind of go from there, man.
That'd be awesome. Yeah, I appreciate the platform again and having me on, and I really appreciate it, guys.
Yeah, thanks again, Eric. Appreciate your time.
Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter @HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.